You're going about your day, and suddenly, your nose starts bleeding. No impact, no injury, nothing. You tilt your head back, grab some tissue, and think, that was weird. And then it happens again a week later, and again the month after. Here's the thing, most people over 45 don't know, a nosebleed is rarely just a nosebleed. At this stage of life, your body uses unexpected physical symptoms to wave a flag. And a recurring nosebleed can be one of those flags. In this video, we're going to talk about what's actually behind nosebleeds after 45, the real causes, the warning signs you must not ignore, and what you can do about it. Let's get into it. First, let's be clear, most nosebleeds are not dangerous. The medical term is epistaxis, and it affects people of all ages. But the pattern shifts meaningfully after 45. The causes that are most common in children and young adults, dry air, nose picking, minor trauma, are less likely to explain what's happening in midlife. After 45, nosebleeds are more frequently tied to systemic factors, things happening inside the body, and that's exactly why they deserve more attention, not less. Section 1. The blood pressure connection. Let's start with the most important one, and the one most people don't connect to nosebleeds. High blood pressure, hypertension. After 45, the risk of hypertension rises sharply for both men and women. Globally, it's estimated that over 1 in 3 adults over 45 has elevated blood pressure, and a significant portion of them don't know it. It's famously called the silent killer because it produces almost no symptoms, almost none, except sometimes a nosebleed. When blood pressure spikes, the small, fragile blood vessels inside the nasal passages, particularly in an area called Kieselbach's plexus at the front of the nose, can rupture. Under that increased pressure, this is especially common during what's called a hypertensive episode, a sudden acute rise in blood pressure triggered by stress, poor sleep, excessive caffeine, alcohol, or skipping blood pressure medication. So if your nosebleeds seem to happen during stressful moments, or late in the evening, or after a few drinks, pay close attention to that pattern. The action step here is simple, but critical. If you're over 45 and experiencing recurring nosebleeds, check your blood pressure today, not next month. Section 2. Medications that cause nosebleeds. This one surprises a lot of people. After 45, the number of medications the average person takes increases, and several of the most commonly prescribed drugs after midlife directly increase your risk of nosebleeds. Blood thinners, including warfarin, aspirin, clopidogrel, and the newer anticoagulants, reduce your blood's ability to clot. A nosebleed that would normally stop in 2 minutes can last 15 or 20 minutes in someone on blood thinners. That's not just inconvenient, that's a clinical signal. Your dosage or regimen may need evaluation. Nasal corticosteroid sprays, used widely for allergies and sinus issues, can thin the nasal lining over time, especially if sprayed directly onto the nasal septum instead of toward the outer wall. Ibuprofen and other NSAIDs, taken regularly for joint pain, which becomes far more common after 45, also have mild blood-thinning effects that accumulate. If you're on any of these medications and experiencing nosebleeds, don't stop taking them on your own. Instead, bring it up with your doctor. There may be a simple adjustment that resolves the problem. Section 3. Hormonal changes, especially for women. This section is particularly important for women approaching or going through menopause. Estrogen plays a significant and often underappreciated role in maintaining the mucous membranes throughout the body, including inside the nose. As estrogen levels decline during perimenopause and menopause, typically beginning in the mid to late 40s, the nasal lining becomes thinner, drier, and more fragile. This is why many women notice that nosebleeds, which were rare or non-existent before, begin appearing during the menopause transition. It's the same drying effect that causes vaginal dryness, dry eyes, and dry skin. It's systemic. Additionally, hormonal fluctuations can affect blood vessel tone and fragility, making small vessels in the nose more likely to break. If you're a woman in perimenopause or menopause, experiencing frequent nosebleeds, this hormonal connection is likely a significant part of the picture. It's worth discussing with your menopause specialist, and know that simply increasing nasal moisture with a saline spray or a humidifier can make a meaningful difference. Section 4. Blood clotting and platelet issues. Less commonly, but importantly, recurrent nosebleeds after 45 can be a sign that your blood's clotting ability has been compromised. This can happen for several reasons: nutritional deficiencies, particularly low vitamin K, which is essential for clotting factor production liver disease, which reduces the liver's ability to synthesize clotting proteins or thrombocytopenia, a condition where platelet counts drop below the level needed for normal clotting. The warning signs here are specific: nosebleeds that last longer than 20 minutes and won't stop with pressure, nosebleeds, accompanied by unexplained bruising on the skin, bleeding gums, or blood in the urine or stool. If any of these are present alongside your nosebleeds, that combination requires prompt medical attention, not a wait-and-see approach. A simple complete blood count, a CBC, can screen for most of these issues and is something your doctor can order at a routine appointment. Section 5. When it might be something more serious. Let's talk honestly about the rarer, but real, possibilities that need to be ruled out. Certain blood cancers, including leukemia and lymphoma, can present with unexplained bleeding, including nosebleeds, as an early symptom. This is because these conditions affect the production of platelets in the bone marrow. Hereditary hemorrhagic telangiectasia, or HHT, is a genetic condition that causes abnormal blood vessel formation and often doesn't become apparent until adulthood. Recurring nosebleeds, sometimes severe, are its most common presentation, and while rare, nasal polyps or tumors can cause one-sided nosebleeds that occur repeatedly from the same nostril. None of this is meant to cause alarm, but it is meant to make this point absolutely clear. If your nosebleeds are frequent, long-lasting, one-sided, or accompanied by any other unusual symptoms, you need a proper clinical evaluation. A nosebleed that happens twice a year is different from one that happens twice a week. Section 6. Lifestyle and environmental triggers after 45. Now let's talk about what you can actually control. Dry air is the single most common environmental trigger for nosebleeds at any age, and it worsens significantly after 45 because the nasal lining is already becoming naturally drier. If you live in a dry climate, sleep with heating or air conditioning, running, or travel frequently on planes, your nasal passages are chronically dehydrated. Alcohol consumption directly dilates blood vessels and inhibits clotting. A nosebleed after a night of drinking is your nasal blood vessels telling you they've been pushed to their limit. Chronic nasal blowing, particularly forceful, from seasonal allergies or sinus congestion, can rupture fragile capillaries. After 45, those capillaries don't regenerate as robustly as they once did. Nutritional deficiencies matter here too. Low vitamin C weakens capillary walls. Low vitamin K impairs clotting. Both become more common after midlife, particularly in people with restricted diets or absorption issues. What to do? Practical steps. Here is what you can do starting today. Use a saline nasal spray once or twice daily to keep the nasal lining moist. This is one of the most effective and underused tools available. Run a humidifier in your bedroom, especially during dry months or winter. Apply a small amount of plain petroleum jelly just inside the nostrils at night. This dramatically reduces dryness-related bleeding. Check your blood pressure regularly. A home monitor costs very little and gives you data that could genuinely save your life. Review all medications and supplements with your doctor, including over-the-counter pain relievers and blood thinners. Eat a diet rich in vitamin C and vitamin K, leafy greens, bell peppers, citrus, broccoli, and reduce alcohol, especially if you notice a correlation between drinking and nosebleeds. If a nosebleed happens, lean slightly forward, pinch the soft part of the nose firmly, and hold for a full 10 minutes without releasing. Do not tilt your head back. That sends blood down the throat. When to go to the doctor, the non-negotiables. Go to a doctor or the emergency room if the nosebleed does not stop after 20 to 30 minutes of firm pressure. You lose a significant amount of blood. The nosebleed followed a head injury. You experience dizziness, chest pain, or difficulty breathing alongside the nosebleed. You're having nosebleeds multiple times per week with no obvious cause. Or you're on blood thinners and the bleeding is unusually heavy or prolonged. These are not situations to manage at home. These are situations that require medical evaluation the same day. Your body after 45 communicates differently. The signals are subtler, but they're real. A nosebleed isn't dramatic. It doesn't feel urgent. And that's exactly why so many people dismiss it. Don't dismiss it. If this video was useful, please hit the like button. It genuinely helps more people in the 45+ community find content like this. Subscribe for more videos on midlife health, and drop a comment below. Have you dealt with nosebleeds after 45? What turned out to be the cause? Your experience might help someone else watching this right now. Take care of yourself. See you in the next one.